My name is MAGSINO, a third-year nursing student, and in this video, I'll be talking about a disease that associates with blood coagulation. At the end of this video, I hope that it becomes an added knowledge for yourself.
Ever wonder when you get injured? Let's say you scrape your knee, and now it's bleeding. Uh, if you wait a while, the bleeding slowly stops, and now that the blood starts to form in a gel-like thing. This is called coagulation or clotting. When clotting happens, that gel plugs the leaking blood vessel. But what is it that makes it form? What is it that binds it? And that is the von Willebrand factor, which has the major role on acting as a glue when blood clots in the site of injury. The clots protects the site of injury by sealing off damaged blood vessels and preventing further blood loss. But what if this von Willebrand factor is somehow malfunctioning or an individual has less of it? That is where the von Willebrand disease comes. The disease is a blood disorder that highly focuses on quality and quantity of the von Willebrand factor. This is a blood glycoprotein found and made within the endothelial cells. A slight history. The von Willebrand disease was discovered and studied in the 1920s by a brilliant doctor named Dr. Erich Adolf von Willebrand. He discovered this upon observing a bleeding disorder on a 5-year-old girl and her family. So what happens if one has the von Willebrand disease? Normally, when one is injured, the von Willebrand factor will act as a glue. However, if one has the disease, the blood clot will form slower or does not form clots at all. The disease has 3 types. Type 1, the most common von Willebrand disease in which an individual has low levels of von Willebrand factor. The individual will likely to have bleeding problems because of the slowness of blood clot formation. Next is the type 2, which is broken down into 4 subtypes, A, B, M, and N. Type 2A is where the von Willebrand factor is not on the right size and doesn't help platelets to attach together to form a clot. Type 2B, the von Willebrand has wrong timing of attaching when there is no injury. When this happens, the body responds by removing platelets that is attached to von Willebrand factor, therefore reducing von Willebrand factor in the blood. Type 2M, the von Willebrand factor does not attach to the platelets, therefore decreases the platelets' ability to form a clot. Type 2-2N, the von Willebrand factor attaches to the platelets, however does not attach to factor 8. Factor 8 is an essential blood clotting protein. It is also needed for blood to clot. So, in this case, the type 2N acts like it's like a fake glue. Type 3 is the most severe case of von Willebrand factor disease, from which the affected individual lacks or has no von Willebrand factor at all. So, who is affected by this disease? The origin of this disease is that it is inherited from parental genes. It means it's genetic. In some cases, it can be acquired, such as if a person or individual has a disease and is prescribed by medication that interfered with the von Willebrand factor. Signs and symptoms: frequent nosebleeds that last for minutes. It can be spontaneous, hard to stop, excessive bleeding after surgery or dental work, easy bruising like scrape into a wall or fell on the floor. In women, they experience heavy menstrual bleeding. They show signs of fatigue and anemia. At this point, anything that makes an individual bleed, like cutting yourself with a knife on your arm, it will last for minutes. There will be a slow coagulation or no coagulation at all. Next, we have the diagnosis for the von Willebrand disease. The doctor will ask questions about personal and family histories of bleeding. The doctor will check for unusual bruising or other signs of recent bleeding and order some blood tests to measure how the blood clots. Screening tests such as CBC measures the amount of hemoglobin, the size and number of red blood cells, and the numbers of different types of white blood cells and platelets found in blood. If a person has von Willebrand disease and has shown excessive bleeding in the past before consult, the hemoglobin and the red blood cell count can be low. Activated partial thromboplastin time (APTT) test measures how long it takes for blood to clot. Specifically, it measures clotting ability of factors 8, 9, 11, and 12. If any of these are low, then it would mean that the blood takes longer time for it to clot. Next, we have blood tests. Factor 8 clotting activity to measure the amount of factor 8 in the blood. Von Willebrand factor antigen to measure the amount of von Willebrand factor in the blood. Von Willebrand factor multimers to measure the makeup or structure of the von Willebrand factor. Platelet aggregation test to measure how well the platelets are working. Treatment depends on the severity and type of disease. Desmopressin acetate injection or nasal spray works by making the body release more von Willebrand factor into the blood and also helps increase the level of factor 8 in the blood. Replacement therapies are the mainstay of treatment for patients who do not respond to desmopressin. This includes infusions of concentrated blood clotting factors containing von Willebrand factor and factor 8. Oral contraceptives for women. Estrogen hormones in the pills can boost von Willebrand factor and factor 8. Nursing management. Build rapport to the patient. A good rapport with the patient means a good establishment of trust and the patient is comfortable with your presence and service. Wear proper PPE to avoid cross-contamination. Assess skin for any presence of broken skin integrity, for this may lead to risk of infection. Remove any hazards that may harm the patient for it risks the patient to be hurt. Avoid intramuscular injections. If bleeding occurs on external area, apply RICE, rest, ice, compression, and elevate. Good for assisting in clotting also. As per doctor's order, administer with appropriate factor. Document findings and record results. And here is my reference for this study. And thank you for listening. Thank you.